Good. Okay, so as Tina mentioned, very happy to meet everybody here. I'm Angelos Anastasopolos, Dr. Anastasopolos from Health Canada, and here with Matt Rouleau. And we will be presenting our findings on health impacts of air pollution in Canada. These are recent findings, and we're really going to plug the report that just recently got published and encourage everybody to go and look at and use it after the fact. So recent findings on mortality, on morbidity, and monetized costs. And here's the focus here. It's by transportation, industry, and residential sectors. So as we'll see in a second, the work is heavily focused on sector breakdowns and sector comparisons, which I think is what makes it interesting. So we'll start by, let me just jump back here. Yes, just to plug, as I mentioned, I want to plug the report that we have. So the report was published just early this year. We're going to put the link in the chat, so keep an eye out for that one. And here is just the cover page of the report, so you kind of can see we've titled it Health Impacts of Air Pollution from Transportation, Industry, and Residential Sources in Canada. It's a good-sized report. It's a little over 100 pages. There's also supplementary material available if you request it when you download the report. So a lot of information there. And the point of this presentation is to kind of distill some of that into our high-level findings, show you how the report's laid out, and then hopefully build some interest. Now, all these findings are based on a lot of work, a lot of modeling, as you're going to see in a second when Mathieu kind of takes over from me here. And so I wanted to just take a moment to acknowledge the project team. It's a joint effort here between us at Health Canada and Environment and Climate Change Canada. So at Health Canada, it's ourselves, Matt and I are in the same division, Air Sectors Assessment and Exposure Science Division. And it's also the Economic Health and Analysis Division, which allows us to, of course, put the costs and the health impacts modeling that you'll see. And at ECCC, we want to mention the hard work of our colleagues there, which is the Air Quality Policy Issue Response section, and of course, the Meteorological Service of Canada, where a lot of our modeling is done. That's our working collaboration that we have. So with that, take just one more moment just to kind of show you what we plan to talk about today. So first of all, we're going to introduce the project because this was more than a couple of years of work, I guess, by the time all is said and done to publication. And so what were the objectives of this work? And then we're going to get into the methods because it is a modeling-based work. The details, I think, have quite a bit of importance. And I know that in the audience, we have people that are going to be interested in how we go from air pollution to health impacts. So Mathieu is going to kind of demonstrate that at high level. And then we're going to focus most of this presentation, just as the report does, on, well, what are the findings? What are the health impacts that we found, and for various sectors and at various geographic scales? So we're going to focus here on national and provincial territorial scale. And then in the third part of the presentation, we're just going to we've pulled out, I should say, a few example results that we think are worth kind of spending a little more time on. So first of all, some sectors that are of particular interest. And then we're going to take one example of an air zone. It happens to be a highly populated one, and we'll just kind of have a snapshot of what the health impacts are like in that air zone. And finally, we'll wrap up with kind of high level, what are the key findings? And it's not over. We're kind of continuing this kind of work, of course. Science is always marching. And so we're going to look at what is coming next, what we're working on right now. So with that, the project objectives for the Sector Health Impact Assessment Project were really to, as you imagine, to quantify the air quality and the health impacts. But the key thing is by sector. We've done this health impact analysis before at Health Canada, and you've seen it also in the published literature. This was an opportunity, however, to look at the health impacts by sector for a large number of sectors. We wanted to have a scope that included different kinds of sectors. We wanted to include transportation, industrial, and residential sectors. That was very important. And so you'll see in a second when Mathieu shows the sectors we modeled, the kind of coverage that we did have. And the reason for that is because we were aiming to have results that would allow comparison, results that would allow some relevant information to be pulled out that you could then act on. That was kind of the point, to inform policy, to inform various kind of regulations, to inform even other mitigation strategies, or generally speaking, to inform air quality management strategies. And so the way to do that is to allow comparisons. And the way to allow comparisons, of course, is to have modeled all these sectors at the same time in the same model with the same kind of quality of inventory data and so on. And so that's exactly what we set out to do. And I think what we've succeeded in doing as this big first step on this project. And last, I mentioned the comparison is also by region. Very important because, as we'll see, sectors that are of importance in one part of the country for potential action and air quality management may not be the exact same sectors that are worth prioritizing or best to prioritize in another part of the country. And so the comparisons are made that way as well. And last, as I've mentioned here, the objective really was to produce results that could be actioned, that could inform policy and management strategies. So with that, okay, as I mentioned, how do we do it? Well, it's modeling based, but let's get into how exactly it's done. So Matt, I'm going to just turn it over to you.
Yeah, thanks, Angelos. So as Angelos previously mentioned, we looked at three main categories of sources. So there was transportation, industry, and residential. And within each source, we targeted specific sectors or subsectors. And if you look on this slide, the number in parentheses represent the number of sectors or simulations for each type of source. And in total, we had 21 sector scenarios that were completed. And now, how did we choose these sectors? Well, first we looked at the emissions inventory and we tried to select the large contributors. And we also considered sectors of concern. We can think of on-road transportation, some oil and gas sectors. And we also wanted to look at some overlooked sectors, and I'm thinking here of residential wood combustion, an obvious source, but never really studied before. And some sectors, of course, were excluded. Either they were being investigated elsewhere, such as wildfire, or the data were uncertain, or even the computing resources were not unlimited. So we had to prioritize a certain number of sectors, and these 21 came out on top. So we can go to the next slide. And so our modeling framework for this analysis, first of all, as Angelo said, we worked in close collaboration with partners at Environment Canada for the development of the emissions inventory, so our step 1, and also for the air quality simulations, step 2 in this framework. And Health Canada completed step 3, the health impact modeling. So very briefly for step 1, we used the air pollutant emissions inventory for the year 2015. Now this inventory was published in 2017, and it represented the most recent and complete inventory for air quality simulations when this project was initiated a few years back. So the air pollutant emissions data were processed and then spatially allocated by Environment Canada for use in air quality modeling in step 2. So for the air quality simulations, Environment Canada used the GEMMAC chemical transport model. So it is their operational model for air quality simulations to inform regulatory development as well as air quality management decisions. Now, this model provided us with ambient air concentrations for fine particulate matter, so PM2.5, nitrogen dioxide, ozone, as well as sulfur dioxide. And we had estimates on a national grid with a 10 kilometer by 10 kilometer resolution. Now, these gridded concentrations were then averaged over different geographic units, including census divisions, provinces, territories, air zones, as well as the entire country. And so Environment Canada ran their model for 21 sector scenarios, as well as a base case or a reference scenario. And so we can go to the next slide, and I'll come back to step 3 later on. So once we had results for our 21 sectors in the reference scenario, we had to evaluate the contribution to air pollution for each sector. And so to isolate the impact of a given sector, we compared 2 air pollution scenarios, the base case and a sector scenario. Now, our base case scenario accounts for all emissions in the inventory. So here we're trying to estimate the real world ambient conditions. And the sector scenario uses the same emissions inventory, but it will zero out the emissions from the targeted sector. So for example, if we're trying to estimate the contribution from on-road traffic pollution, we'll exclude on-road traffic emissions from the simulation, and we'll input that sector as 0. And now the difference or delta between the two scenarios reflects the contribution from the targeted sector to ambient pollution. And ultimately that represents the population exposure attributable to the sector. So we can go to the next slide. And so the final step in our framework is the health impacts modeling step. So here we estimated the health impacts using our own air quality benefits assessment tools, or the ACBAT. So this tool was developed and is regularly updated by Health Canada. So it is. So this model, it gets complicated, but if we simplify what goes on into ACBAT, we end up with basically two equations. And the first equation on top here is used to estimate the health impact. So we consider 4 variables. So first of all, there's the exposure concentration, and that comes from our air quality modeling. Afterwards, we have a measure of the risk of an adverse health effect from exposure to an air pollutant. So for example, and these are not real numbers, but let's say our estimate of risk could be a 5% increase in asthma symptom days for every increment of 1 microgram per cubic meter of exposure to PM. That would be our risk estimate. Then another variable we need to account for is the population that is exposed. And lastly, there's the state of health of the population. And here we mean a baseline measure of a health effect or an endpoint in the population. For example, this could be the mortality rate in a census division or a province. That would be our state of health for that endpoint. And we'll draw from different data sets for these variables, where it includes our air quality modeling, of course, and then we draw data from the census, from health studies, as well as from administrative and medical records. So it becomes a data-rich tool. And this first equation, we'll use it for each air pollutant health endpoint pair in ACBAT. So they are listed in the table at the bottom of the slide. You can look maybe at that later on. But so we have about 20 endpoints in ACBAT. And so the second equation is where we multiply our health impact by a monetary value that represents people's willingness to pay for a reduction in risk of a health effect. So this allows us to monetize the health impacts, and it provides us a useful metric to compare an air pollution health burden with the cost associated with a regulation or some mitigation strategy. Now, ultimately, at the end from ACBAT, what we get out of it is we get estimates for around 20 endpoints, so including mortality and morbidity endpoints. And we also get results by census division, as well as by air zone or province or territory, depending on what geographic unit we're interested in. So in a nutshell, that's pretty much the framework. And I'll pass it back to Angelos.
Excellent. Matt, thank you very much. Very well explained. And really, the takeaway here, I will say 2 things, is that you saw there's like the 3 tiers of models, that one goes into the other, as Matt mentioned, and then a lot more details than even what Matt was able to have time to present here, found in our report. So you can read the report. We definitely go into all kinds of details there on the exact modeling used, assumptions, all kinds of details there. And we're more than happy to have follow-up discussion after the fact, or even outside of the presentation, on some of the details of the modeling. But with that, what we'd like to focus on today are the results. I mean, that is really what we're here to see, is what have we found out? How do these health impacts compare across sectors? So what I'll start with is just kind of at the higher level, looking at some results nationally, and then looking at some results provincially. And let's see kind of what we found. Okay, that brings us to here. So this graph here kind of tells the really high level overall findings at the national level. So what we're showing here, we're showing mortality as the endpoint, and as the primary endpoint of concern, I think, for most of our discussions is the number of deaths annually attributed to air pollution. So this is the mortality number here, the count. And it's important to also mention that this is the total mortality from the modeled pollutants. So from all the pollutants that we've modeled, like Matt mentioned, so PM2.5, NO2, ozone, and summer ozone. These are the pollutants that we included in our endpoints for mortality and for morbidity, and therefore we can add up the deaths across each of the pollutants to come up with a total by each of the sectors that we looked at. So one last kind of fine point to mention here is you see there's only so many bars on the plot, and yet you remember we modeled 21 sectors. It does work, the math does work. It's because some of the sectors that we modeled are actually subsectors within the overall sector. So for example, all on-road transportation, which you can see here, the blue, of course, it contains like light-duty vehicle, like gasoline vehicles, heavy-duty vehicles, off-road equipment. So you can see there's multiple additional sector scenarios inside it. And we have, of course, all of those results tabulated and available to anyone that's interested in the report. But this is the overall, comparing one overall sector type to another. So with that, you can kind of see if we were to add across all the sectors that we modeled, we have 6,500 deaths annually for the modeling year of 2015 attributed to air pollution from these sectors, from these 21 sectors that we've looked at. A large number, and one that's almost worth some pause right there just to appreciate. And it gives us a little bit of reassurance as well, because it's less, of course, than the total that we've estimated in the past for all air pollution attributed to air pollution in Canada generally. Matt, can you remind me? I want to say it was 15,000 or so, the most recent report.
Yeah, the report published in 2021. Yeah, 15,000.
Yeah, so about 15,000 deaths annually. And so that's kind of good to have in the back of your mind, because that report, of course, also we can make that link available. It tells you the overall impact, mortality, morbidity impact of air pollution, very important, but it, of course, did not go and then break it down by sector. That's what this follow-up work, this kind of separate project is able to do. And the second thing to mention is that you can see that we weren't able to model all of the sectors that are in the inventory. And yet of the ones that we chose, the scoping, I think, was quite comprehensive. And you can see that we're explaining, in this case, 6,500 deaths of the overall total. So well on the way to being more inclusive. And of course, follow-up work is going to only improve that. Now, the next thing to mention is the monetized costs that are equivalent to the overall health burden. And when we say overall health burden, we're talking here about the mortality, which is what we're spending most of the time on, but also the morbidity. So looking at the premature mortality and the morbidity and putting a monetized cost on it, the number to kind of take away from this presentation and in our report is $51 billion annually in monetized costs, a considerable number that goes along with the 6,500 deaths and then the morbidities that you'll be able to find in tables in our report. Now, of course, we're here primarily not to just look at the numbers, because we have it for the overall air pollution burden, as we mentioned in our regularly updated reports. It's really to be able to look at comparison between sectors. So right off the bat, at the Canada-wide national scale, we can say, okay, which are the sectors with the greatest health impacts? Finally, we can come back to the plot that's been kind of sitting on the screen here for a while, and you can kind of see, as you noticed already, I'm sure, it's home firewood burning or residential wood combustion is the top ranked sector with 2,300 deaths annually, followed by all on-road transportation with 1,200 deaths annually, followed then by an industry sector, the ore and mineral industry, at 910. And the other thing I wanted to mention here is that the home firewood burning is almost 2 times higher than on-road transportation. That's kind of amazing and perhaps surprising to some, given most people, when you say think of air pollution, what do you think of? We often think about streets, cars, machines, that kind of thing. So we think of transportation, and we most often think of on-road transportation because that's what we're familiar with, whether we're active commuters or whether we're driving our own vehicles. It's something we regularly have to engage with. And so you would not be surprised that on-road transportation would rank highly in terms of the health burden. But the surprising thing perhaps is that a residential sector, home firewood burning, is even higher than this very well-known and well-understood air pollution source of on-road transportation. So quite an interesting finding right off the bat. And then let's look at now provincial results. And this is interesting for kind of a different reason. We tried to keep kind of similar color scheme here for the sector types. Two things to mention here. First of all, where are we finding the highest overall health burdens, the highest mortality counts? We're finding it in Quebec, for example, followed by Ontario, followed by BC. This makes a lot of sense because these are the most populous provinces, and so not really a surprise there. What's more interesting is, of course, well, what are the sectors that are in the top three, and how do they compare regionally across the country? So two basic kind of classes kind of trickle out of this. The first is there are some sectors that are ranking highly in nearly all provinces. They're kind of important everywhere. They're contributing a lot of air pollution and therefore a lot of health burden right across the country. So these are the ones, as you would guess, as we mentioned in the last slide, it would be residential wood combustion and it's on-road transportation. But on the other hand, we have a different second class of sector, which seems to be sectors that are very important in terms of they're contributing a lot of health burden, a lot of mortality in this case, in some parts of the country only. And of course, or maybe not of course, but it kind of corroborates a little bit what you might have thought. These are industry sources for the most part. It makes sense because industry facilities tend to be regional in where they're concentrated, where they're located, where they operate. And so that's not a surprise. And if we kind of look across the country a little bit, you'll find that oil and gas industry sector, of course, is highly ranked and important and contributing a lot of air pollution related mortality and health burdens generally in the West, specifically Alberta and Saskatchewan. In the middle of the country, you're finding the ore and mineral industry as a significant sector contributing a lot of health burden. So that's in Ontario and Quebec. It's also in Manitoba and New Brunswick, in fact. Then electric power generation. Now, when we say electric power generation, I want to clarify, we modeled the overall sector of electric power generation, and we also modeled, as Mathieu showed, the coal-fired electric power generation. So you can kind of guess here what's driving these numbers is the coal-fired power generation that is still in a few locations in the country in 2015 when we had it as our modeling year. And so where it's a highly ranked sector within the top three, it's in the West, Alberta and Saskatchewan, and it's the Atlantic provinces. So it gives us a nice kind of understanding of where this is still contributing a lot of burden. And then another one worth mentioning is marine transportation, which of course comes up, as you'd imagine, on the coast. In this case, it's the Atlantic provinces of Nova Scotia and Newfoundland. So it contributes significantly. It's the third ranked sector, or it's in the top three in those locations. Now with that, the last point I want to mention, of course, is the monetized cost. This is another way to understand the health burdens and to communicate them. And again, I mentioned that one of the objectives was to produce results that were actionable by air zone managers and others that are involved in air quality management, other decision makers. And so in addition to the mortalities, the morbidities, the costs are also a very important part of that story. And so you can see if we were to just choose, for example, Quebec, we have in the province of Quebec, 17 billion in monetized costs attributed to just these three sectors, the top three ranked sectors. Of course, it's more when you look at all the other sectors that we modeled. They all contribute something to monetized costs and to health burden in Quebec as well. But just these top three, you're at $17 billion. in Ontario 12 billion, in BC 4 billion. So these are large numbers, even when you break down to the provincial size. Now with that, I'm going to flip things back to Matt, and we're going to kind of zoom in a little closer now. We're going to look at some specific sectors, and then we're going to jump and take one example, Arizona, and talk about what we have in our report at that level. So Matt.
Yeah, thanks, Angelos. So I'm looking at the chat also and looking forward to the question period. I just want to, maybe we didn't stress this at the beginning. We're only looking at outdoor air pollution in this analysis, and also it excluded occupational exposure at the same time. So it's really ambient pollution that we're interested in this analysis. That might answer some of the questions. And it also excludes backyard burning as it wasn't part of the residential wood combustion. So the first sector we wish to highlight is residential wood combustion. Residential wood combustion emissions are a relatively understudied and mostly unregulated source of pollution. It was also a challenging source to model, owing to some data limitations associated with the air pollutant emissions, both in terms of their regional distribution as well as the magnitude of their emissions. So a lot of effort went into developing and selecting the most appropriate inventory for this source. So based on the inventory we selected, so residential wood combustion was a dominant contributor to particulate matter emissions in all provinces and territories except for Nunavut. It also contributed highly to volatile organic compound emissions, as well as to carbon monoxide and ammonia. Now, in terms of ambient air concentrations, residential wood combustion was a top contributor to ambient particulate matter concentrations nationally and in most provinces, especially in BC and Quebec. Now, these high exposure contributions to air pollution translate to elevated health impacts in most provinces and air zones. And nationally, this includes 2,300 premature deaths. And if we look at provinces, we're looking at 1,500 premature deaths in Quebec, 550 in Ontario, and around about 250 in British Columbia. So RWC, or residential wood combustion, is also associated with thousands and millions of non-fatal health endpoints for the endpoints in AGBAT. And overall, so the monetized costs reached $18 billion in 2015, which, as we will see on the next few slides, is 2 times greater than on-road transportation impacts, which traditionally have been the reference in terms of health burden. So if we can go to the next slide. So on this slide, this map is showing the relative contribution of residential wood combustion pollution to annual average fine particulate matter concentration. So it's percent contribution to the ambient PM levels. So first thing to notice here is we see a clear regionality with much higher contributions to ambient concentrations in southern central BC, as well as southern Quebec. So we're seeing here we're looking at the grid scale results. So we're seeing contributions up to 70%, which is drastically, it's very high. But even if we look at provincial averages, so our modeling suggests that in Quebec, residential wood combustion can contribute up to 40% of ambient particulate matter concentrations on average annually. And in British Columbia, that contribution is up to 22% on an annual basis. So again, very high contributions. So we can go to the next slide, and the second sector we wish to highlight is that sector is on-road vehicles. Yes, vehicles are getting cleaner, but their contribution to ambient pollution and to the health burden remains high and it's of concern. So if we look at emissions from on-road traffic, so it is a top three sector in most provinces, especially for gaseous pollutants, so volatile organic compounds, nitrogen oxides, as well as ammonia. And many of these are precursors to secondary PM. So that's very important. And if we look at, if we dig a little deeper, not really that deep, but if we look at the different vehicle classes, we see that heavy duty vehicles, which are mostly diesel vehicles, emit a larger fraction of particulate matter and nitrogen dioxide or oxides, whereas light duty fleets, which is mainly composed of gasoline vehicles, emits more VOCs, carbon monoxide, and ammonia, so the gaseous pollutants. Now, looking at ambient concentrations, on-road traffic is a top contributing sector to ambient PM pollution, NO2 pollution, as well as ozone pollution, and that is nationally and in most provinces, including the most populous provinces of British Columbia, Ontario, and Quebec. So again, as we expect, if we see high exposure concentrations, that translates to elevated health impacts. And for on-road traffic, that number, the health burden reaches 1,200 premature deaths in 2015, as well as, again, thousands and millions of morbidity outcomes some are listed here. And overall, the monetized cost for on-road traffic pollution reaches $9.5 billion in 2015, and 2/3 of these impacts are linked to the heavy-duty vehicle class. And I'll just note, and I'll be adding a link in the chat soon, we published the on-road traffic results in a separate report in 2022. So in there, there's a lot of details on, of course, the traffic part, on traffic pollution, but that report also includes a lot of details on the modeling behind the sector's analysis. So that's another reference for those who are interested. And now I'll pass it back to Angelos.
Excellent. Matt, thank you. So now a different focus as we kind of get towards the tail end of our webinar here today is let's now look geographically. Let's pull out one air zone, because maybe we didn't stress this quite enough, but this is the first time that we have aggregated our health impact results, our health burden results at the air zone scale. So even putting aside sector-based results, just overall how we tend to model health burdens across the country, we have of course always reported national and provincial territorial, very useful, as we saw some examples previously. But we thought that it would be of value to go to a smaller geographic scale and aggregate the health burdens at the air zone scale, because at the end of the day, that is the scale. Air zones there's about 50 of them across the country, more or less, give or take. Some provinces and territories have many, 6, 7, 8, and some provinces or territories have 2 or even 1 in some cases. So it depends on where you are in the country. And generally speaking, these boundaries are drawn as an area that air quality management can be applied. So it's basically an area of jurisdiction for the various stakeholders, and especially the air zone managers, who are actually assigned under the air quality management system to regulate air quality and kind of encourage continuous improvement, lowering the ambient air quality levels within an air zone. And of course, it goes without saying that the lines have been drawn in such a way that, depending on where you are in the country, there's certain things in common. And so perhaps there's sources in common, perhaps there's geography in common. But at the end of the day, these are the boundaries that have been adopted across Canada, and they've been very useful for air quality management. And we wanted, therefore, to give them some data at that scale that they could just immediately take and use. So in our report, we have a comprehensive appendix that has results for every single air zone that we've looked at, and we thought we'd pull one out so that you could see what we're reporting here. And we grabbed Southern Ontario. Why? Simply because it's highly populated. We could have grabbed another one, but this is one that we thought we would kind of show as an example. So, of course, it's in central Canada, highly populated, as I mentioned, approximately 12.4 million people. Then the health impacts from the model sectors, just in this air zone, were 2,200 deaths. So you can kind of see why we picked it, because the provincial total for Ontario is 2,400 deaths, and the majority of that health burden is within this air zone of Southern Ontario. Again, makes sense. This is where the majority of people in Ontario live. It's up and down this corridor, essentially. And the monetized costs, mortality and morbidity endpoints, are 19 billion within this single air zone. Now, the pollutants that are driving these health impacts, as you imagine, this is the case generally, is PM 2.5. And if we had to break out of that 2,200 deaths, how many are attributed to PM 2.5 in the model? It's 1,800 deaths. So again, it's a majority, it's 1,800. And followed by the next most significant pollutant in terms of contributing to health impact, it's NO2. And which sectors are contributing in this air zone? Well, some of them by now are starting to sound like the usual gang, right? So we have home firewood burning or residential wood combustion. It's 500 deaths in this air zone, and of course dominated by PM 2.5 contributions from biomass combustion, of course, followed by on-road transportation. Again, that's what we noticed elsewhere. Now it's a lot closer here, 510 deaths from home firewood burning, and very similar, 470 deaths annually from on-road transportation, followed by the ore and mineral industry sector. So our first kind of industry sector of importance in this region, in this air zone. And then you have another transportation sector at number 4 that is very similar in terms of number of mortalities, 370. It's the off-road and mobile equipment sector. And so a takeaway here for this particular air zone is that we have multiple sectors with similar impacts. And so this is one example, one kind of little case study. When you look through our report and through the appendix, you can kind of look up areas, whether it's places you work or live in or things you're studying, and it'll be, I think, very relevant and interesting. And you'll see that there's a range of results. So in this case, we had multiple sectors with approximately the same impacts. In other cases, there's a very clear number 1, number 2, followed by ... So again, it's worth kind of flipping through the results and treating it essentially as a reference. So with that, we can kind of step back a little bit and kind of remind ourselves of what we've seen so far, what we presented and what we found with this project and what's in our report. So the first key finding is that the individual sector health impacts, they don't always align with the emissions inventory inference. There's a temptation, I think. The emissions inventory is, of course, the start point for the modeling, and it's also a useful reference in its own right. You look it up and you say, wow, this sector has a lot of this or a lot of that or not a lot of that pollutant. Okay, great. But you cannot just kind of leap from that, especially when you're comparing sectors, to, well, then therefore I'm going to know what whether this will be an important sector or not in a given part of the country, in a given region. You need to go through the steps and quantify this with the multi-step modeling to then have estimates of the air quality impact and the health burden of a particular sector from that initial emissions inventory. Now, the next thing is that for the key sectors, which we've looked at, the geographic scale is important. So what sectors that rank highly for a very high health burden at the national scale, they're not necessarily the sectors that are of interest and therefore perhaps important for actioning in some way at the provincial territorial scale. And even if they are for a particular province, and we saw some examples where that's the case, then that doesn't necessarily mean that that's going to follow at the even smaller air zone scale, which is where the management actions can happen. And so again, it's important to consider where you are to then decide what is of most relevance and what actions you may have available. And that brings us to this point, which is that the sector-based health impact results, which we've done in this report, we hope are going to be helpful to air quality management for better targeting the most important and most relevant sources at various levels, including specifically at the air zone scale, where the framework exists for doing this. And the last point I think I'll mention here is that we looked at 3 classes. I said at the outset, you see it in the title, we have transportation, we have residential, we have industry sources. They're all important. All these 3 classes had sectors within them that came up as contributing significantly to air pollution health burden. Now, the last thing, again, is one more plug for the report. The link we've put in there. You can download it and look at it. And that brings us, I think, to our last slide, which is, okay, the report's done, it's published, fine, but things are moving on, and that was 2015 modeling, so what's next? So the first thing that's next is air quality and health burden modeling, more of it, in other words. What specifically are we working on right now with ECCC, with Environment and Climate Change Canada? We're modeling the agriculture sector, first of all. And I'll pause there because I'll say that this is the first time that we will have modeled the agriculture sector. It's always been a bit of a question mark in the results. Looking at the emissions inventory, there's some significant emissions. But as I mentioned, you can't jump to conclusions. You need to go through the steps. We are now going through those modeling steps with our partners at ECCC. And we are doing this with updated 2019 emissions data. So higher quality, more up-to-date data. And that will give us a very interesting set of results that we can then put in context of some of these other sectors that we've talked about today. And the other sector that we're modeling right now is residential wood combustion. We kind of stressed it again and again, both myself and Matt, as a sector that came out very highly ranked. And so we are running modeling again on this sector, but with 2019 emissions data. So the most confidence now in this data that Environment Canada has. And so we're pretty excited to see some of these results. We've looked at some preliminary results already. Now, having said that, what we found is residential wood combustion, the numbers are going to change a little bit, but it's going to remain a top-ranked sector nationally and in a lot of the places where we found that it was important in our present modeling. So in Quebec and in BC, for example, in particular. So, but it'll be very nice to have that final data that we can share when it's finalized with everybody. And in addition to that, we are also working on, this is kind of a fun, exciting one, an interactive website. And this will be the first time that we want to share sector health burden data, not just this data, but possibly other in future, outside of just a static report. And so we're going to be working on an interactive website with our government partners over the coming fiscal year and into the next. So stay tuned, and we're definitely keen to give updates on that as it starts to take shape. And that brings us to the end. So thank you, and I think we'll have some questions that Tina's going to kind of help us with.